the biggest thing that we also forget about is our staff have to deal with our decisions, right? So if you're making their life hard, they're not going to be happy. So if they're engaged in this mapping and they're able to say, okay, I know you offloaded this to me, but look how much time I'm spending there. And there's this technology that can make my life easier and I'll be a happier staff, then maybe that's where you want to put your efforts, right? Like, and then they have buy-in, because if they have buy-in, then they're more likely to be part of the solution. So I think there's a lot of pluses there. Like, technology is just a tool. It's not going to save you. It's not going to be like the light at the end of the tunnel. It's just a tool. So just like your EMR is a tool, just like the other digital health stuff is a tool, it's kind of how you use it and if it actually helps you.
How do we start shifting that, vibe in terms of the physicians across the country, become an early
Yeah.
adopter, or at least like
Yeah.
start getting excited looking into these things, as opposed to like, oh, this just seems like another task,
Yeah.
another unpaid chore. Because I
Yeah.
mean, I think there's a lot of potential there to start putting some light at that end of the tunnel and giving
Yeah.
people more hope and freeing up their time. How do we genuinely change that culture in medicine?
Digital education in with the learners, um, digital onboarding. So if you're a new doc that's just graduated, or a locum, or a new doc to the country, then you should be like, here's all the tech that's out there, right? Because if you get them early before you start a practice and get kind of bogged down, you're more likely to make those changes and get excited about it. You need to find champions, right? Like, so in my clinic that I was in, there's 7 of us, and then there's 2 of us who are just more digitally inclined. And it's like, look at this cool thing that we discovered. And then the others are like, oh, can we use it? Right. So it's kind of like that infectious digital champion piece.
Yeah.
And so that could happen at a clinic level, or like I said, like a regional level. What if it's a community of practice, right? Like, if you've got all these EMRs in your region, there's nothing stopping from someone starting a community of practice where you share this information, because that's how a lot of this started in Ontario and still goes on, right? So it's kind of like the small pieces there, right? Then the other pieces is getting investment from the government to do this, right? To advocate that change management and what we're talking about is really important, and then having funding to set up a program for that, right? We're just in the process of looking at e-coaching modules. So basically, it's kind of like choose your own adventure, right? You start with your module and then you go, okay, this is what I want to learn. And it opens up another module. And then, so you learn what you want to learn, right? And then someone else will go into that module and learn something else. But anyone can do it, and anyone can do it easily. So then you're not limited to signing up at 12 o'clock on this day to listen to a lecture, or, a one-on-one in your clinic. You could do it your own way. So stuff like that, I think it could be easily scoped to the entire country and scaled outwards, but you need a priority and you need funding and you need, like, it has to be done well. So if I had a pitch for Ontario MD, if you find me funding in any province, we'll come and do it for you. But it has to be a priority.
Where do you guys typically house all your not sorry where do you guys typically house all your knowledge? Do you have like an online forum or
Yeah,
community
we
that
do.
docs can like participate in?
Yeah, yeah. So we have, so if you go onto ontariomd.ca, .ca, our website, you'll see our education piece. And if you go into OMD Educates, which is our education line, you'll see all the webinars we've done on lunch. So we're doing one tomorrow on secure messaging portals. We did one last month on AI Scribe. We had like over 800 registrants for a lunchtime webinar, right? They're CME accredited, right? For family doctors right now, but they're CME accredited. So you have access there. In terms of our conferences, like, come see us in Toronto. But the virtual one in June might be an option, right? It's on June 12th, and it's also on our webpage. But that's a great one because you could do it from home and you could look at the tips and tricks, and there's recordings that you can have afterwards. You get all the recordings if you sign up for our conference. So that's a great one. The other educational pieces are really, they're not always recorded. That's the problem, right? They might be live pieces. But we're also available for other provinces, right? So if a province wants us to come and do a education piece for them, so maybe they don't want to invest in an entire program or a change management system or everything I'm talking about, but they just want to kind of talk about AI Scribe or something, then we could come and do a talk like that. Like we could do a smaller version of it. But it's kind of what works for you and how can we help you do it. But at the end of the day, it has to be a priority for your funders.
Yep, yeah, that's the bottleneck for everything, it
That's,
seems.
yeah, that's it. Exactly.
And then how's the Canadian Women in Medicine conference going? Is there a big like digital or AI tech focus there?
It's not actually. So you know what? It's a huge conference. We have around 1,200 in-person attendees usually, and then plus the virtual. So we do have a virtual option too. And it's really about supporting female physicians, like women physicians. Anyone can join. I mean, I don't see any men joining, but any man can join. It's open to everyone. But it is geared towards women physicians. And the program is amazing because you leave feeling so supported. But the topics are not traditional medical topics, right? Like you're not learning about chronic disease or technology. I mean, one year I did a talk on medical apps, about medical apps for yourself for productivity or medical apps for your patients. But traditionally, it's not a digital platform. It's more of a supporting well-being. It's like a wellness conference. So a lot of our speakers are about leadership, about branding, like about confidence, about negotiations, contracts. Like it's stuff that you don't really learn in medicine per se.
A lot of the softer skills and balance and
Yes.
wellness focused. Very cool.
Yes. And how to manage your family and your life. Like a lot of kind of hands-on kind of techniques and tricks and tips.
So, all right, so guys out there, it's a non-discriminatory event. Please
Come.
sign up. So tell me a little bit more, just back to OMD then. What is this digital hygiene initiative you guys are working on recently?
Yeah, so we do a lot of work on burnout. So when I joined 3 years ago, burnout was just starting, right? It's post COVID. We were really seeing the impact of it, and over the years, it's just gotten worse and worse. And really, everything that we do is a lens of a physician, but it's also the lens of burnout. And technology is a big part of that. So Ontario Medical Association actually did a white paper called Healing the Healers, where they looked at burnout from a health system point of view. And what they came up with is that this is not a me, you problem. This isn't me not working hard enough or me not using my EMR properly. This is a health system problem. That's where the solutions need to come. And so they focused on two digital pieces. They had 5 recommendations. And one of the first digital pieces was interoperability and integration, right? Like, don't give me different portals with different passwords that I have to manage. And then the other one is decreasing that administrative burden. Like, we need technology that just kind of tackles that documentation piece, right? So that's where AI Scribe and everything comes in. So along with all the work that I did with them, and then so many talks that I get to go to, that I'm privileged to go to, where I hear other leaders in burnout talking about burnout and their lens and their ideas and their research, um, kind of helps you shape you're in turn, what you're going to focus on. And so my message is always, this is a health system problem. All this has to come top down. There has to be funding and resourcing. And we've talked about that today. But while the health system is trying to get fixed or figured out, there's stuff you can do for yourself, right? Like there's stuff you can do in your little circle to help mitigate that while everything else is working out. And some of that is using your EMR and this education piece. But then there's this whole thing, and it's a term that's coming out called digital hygiene or digital wellness, right? And so I've kind of developed my 5 Bs of digital wellness, kind of based on learnings from a number of great researchers in the field. But it really comes down to, when you use digital tech, you need to kind of look at these 5 Bs. So the first thing is boundaries, right? So you set clear guidelines for how you're going to use it with your patients and how your clinic uses it overall, right? So staff need to know your boundaries. They need to know. So if you have a patient portal for secure messaging from patients, you need to set your guidelines, your boundaries. You need to put that in place. You have to send it out to your patients before they even start using the technology. And your staff needs to know where your boundaries are. And you need to say, I'm not going to do A, B, and C, but I will do D. And set very clear, because a
You don't
lot of
want
this burnout is what it fuzzes,
this
right? Like,
high tech patient support turning into intrusive wear that's just bugging you all
exactly.
day. Yeah.
Exactly. And all of a sudden you're getting all those messages directly in your inbox because you didn't set up a boundary or looked into the technology to make sure that your staff would have to deal with it, right? Yeah. So my second one is bucket filling, right? We all go into medicine for different things, but honestly, I think the majority of us go into medicine for that patient care, right? And that's where my bucket gets filled, is that interaction, that talking, like talking about their dog even, right? Like that's the piece where I kind of leave going, okay, I really have a good handle on who you are, what your problem is. And so I need to find technology that allows me to fill my bucket. So that's why AI is great, because now I don't have to sit in front of a computer typing and writing. I can actually eye contact and talk to you, right? So that fills my bucket, makes me feel better. Patients are happy. Breaks. You need to schedule breaks, right? And what I mean by breaks is breaks from your technology. So just because you have 24/7 access to your EMR, or you have an app that allows you to look at it all the time, doesn't mean you should. So it's about setting a break and saying, I'm shutting down everything and I'm going to do something else. Like that's it. Because we don't do that. And, the whole day goes by. Most of us haven't peed or gone to the washroom or had lunch. And we've been sitting in front of an EMR the entire time. And that's going to affect us, right? So you need to set breaks where you just shut it down and you just walk away, right? Building capacity. So I think that I'm on my fourth B, building capacity. So this is about the training, right? It's finding capacity in your technology, optimizing your EMR, your workflow, design your room efficiently, right? Like a lot of times what we've done is we have a room that was set up for in-person visits and we just thrown technology in there. And now the screen is blocking the patient. Your back is to them. You don't have a good light for virtual visits. They're looking up your nose. Like you need to design your room properly to optimize that and use your tools more efficiently. And my last one is balance. Is that work-life balance? But I'm not saying go do yoga. This is like realistic expectations of what the doctors and you're going to do in your clinic. So if you have a group of 7, you come together and you say, when I'm on vacation, I'm on vacation. We're going to cover each other. I'm not checking my labs, right? But you decide that as a group because that gives you work-life balance. Because if you have 2 docs who are checking all the time and you have 3 docs who don't at all, it's going to create tension. And pretty soon those 3 docs are going to start checking their labs, right? So you need to come together and say, what's realistic? I'm not checking my labs on the weekend, right? There's probably docs out there like, what do you mean you're not going to check labs on the weekend? I was on paper charts forever with a fax machine and no one checked labs on the weekend, right? And I would like to think that none of my patients had any adverse problems because of that, because they ended up in the emerge because they went to the emerge, right? So I'm being tongue in cheek, but you got to set those for yourself. Otherwise, you're just going to burn out, right? Minimum day off a week from charts. Like, do not touch your EMR for a minimum of a day off work because you need to kind of get away from that, right? So I think it's about setting limitations, but you do it as a group with your staff so they don't even bug you. So you're not put in a position where you have to turn someone down because this is the boundary, this is the rule, and this is what we've decided. So it's kind of looking at it that point from a digital wellness point of view.
And then, so how does OMD help the clinics and the physicians, focus on these 5 Bs? Are you guys putting out resources to help like do an inventory and a
Yeah.
self-assessment of, are you checking these criteria, or are you perhaps sliding on one of them?
Yeah, not yet. So this is kind of a new piece that we're working on. That the burnout's not new, but this digital wellness piece. So it's not actually in our one-to-ones yet. Right now, it's more just kind of in talks. It's just kind of getting it out there. Kind of, while you're talking about digital health, don't forget to look after yourself kind of piece. But I think in time, I would like that to be part of the teaching, but honestly, it's hard, Jordan, because docs are hard. Like if you come into a clinic and you have an hour and you want to maximize your EMR, you don't want to really hear about boundaries and bucket filling and breaks, right? Like I think I think the digital wellness piece has a place for it. And you have to kind of know, you have to be in the mindset to hear it, right? Like, because if you're overwhelmed in your clinic, it doesn't matter if I tell you to build capacity. You're going to just slam the door in my face, because I would too. I would slam the door in your face. But if I'm at a conference and I've dedicated that time to wellness, or I'm so burnt out that I had to take time off and now I'm looking for resources, you're in a mindset now to understand it, and you're probably going to listen to it a bit more, right? So I kind of feel like it's more giving the information you need when you're ready to hear the information for anything we talked about today.
Yeah, yeah. So it's sort of up to the docs to like try and keep that open mind, right? It's like how we talk
Yeah,
to our patients about drinking enough water and getting their
that's it.
steps and doing their exercise and all these things, but they're like,
Yeah,
okay, sure, yes. You got to be putting yourself in that position to
yeah,
just do these basic things.
yeah. Maybe you make one of these your QIs, right? Like maybe your QI is setting boundaries so that your patients are happier overall, right? So it's not something that you have to do all at once. It's just kind of just pick one, schedule a break. Every hour you have an alarm go off and go outside and take a couple of breaths of fresh air and then come back inside again. Like just pick something, right? But I just want to say it's not about yoga. It's not about like, finding time for yourself or exercising more. Like this is really about like stepping away from your EMR, stepping away from your app and just getting that break. Like, cause otherwise you're not as efficient.
Well, the 5 Bs framework makes total sense. I hope to see more of it in the future. I guess, just wrapping up on our time today.
Yeah.
Anything else you wanted to shout out before we close off?
No, I feel like, you know what? I feel like we've covered everything. I think my key messages are technology is just a tool. So you have to figure out your needs and what you want solved, and then you find the right solution for that. And technology might be the right solution, but it may not be. AI is not going to solve your problems. So, because it's just a tool. But right now, I think that's where like I'm super excited about AI. I have to tell you. But we need to look at regulations, and we need to kind of have an evaluation framework. And then the other thing is advocating for the resources you need for what's important, right? So if what's important is building capacity and education and kind of understanding these technology better and having someone even rank it for you, like we don't do that. But if that's important to you, where here's 6 options, can you tell me which is the best? Well, if that's what you want, then that's what you advocate for funding in your region or provincially and whatnot. Like, so it has to kind of come down to your needs.
And then we ask everyone at the end of the podcast, what is your number one wellness tip? I feel like I have a
Oh my
good
gosh.
idea now that we've finished the conversation, but what would your top tip be there?
So my top tip is to shut down all your technology and walk away. Um, because I think it's really important to get a real break. So I don't know if you know Dr. Mamta Gautam. So she's in Ottawa, but she is like a guru for burnout and talking about ways to combat that and wellness. And she has this tip called the Tarzan. So basically what it is when you're on vacation, you need to know when your next vacation is before that vacation ends. So it's like Tarzan, you're going from vacation or break to break. So I kind of say it's the same thing with digital wellness. So when you're on vacation, and I know people have already shut me off by now because they're like, there's no way I'm going on vacation and not looking at my EMR. But when you're on vacation, you need to be on vacation, because if you're truly not on vacation, it's just going to build up and build up. And you think that 1 hour that you do every day is going to save you all that time later, but map it out. Take time and see, does it really save you time? Because if it doesn't, then don't do that 1 hour, right? Like it's kind of look down the street a bit.
You got to take some time to decompress. Absolutely.
You have to take time to decompress.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.